Okay, so we're diving into something today that I think a lot of us see, like everywhere, right? Clinically tested, clinically proven.
Yeah.
These phrases are plastered all over wellness products. But what do they actually mean? We've got a stack of articles here ready to break it all down, so get ready to become a more discerning shopper.
It's funny you should say that because one of the things that always gets me is how often you see clinically tested with absolutely zero mention of what the results actually were.
Right, like we tested it, but we're not going to tell you if it worked or not.
Exactly. It's like, what was the point then? It could have been a tiny study with flawed methods, not enough to prove anything.
So tested alone doesn't really tell us much. What about clinically proven? That feels like it carries more weight.
It does, and it should. When you see clinically proven, you'd expect to see some robust clinical trials backing it up. We're talking about randomized controlled trials or RCTs. Those are the gold standard.
RCTs. Break that down for me a bit.
Okay, imagine you're testing a new sleep supplement. An RCT would randomly split people into groups. Some get the supplement, some get a placebo, and nobody knows who got what until the very end.
Like a blind taste test, but for sleep.
Exactly. And that's how you isolate the true effects of what you're testing. You can compare the sleep quality of the supplement group to the placebo group and see if there's a real difference.
Makes sense. That feels a lot more reliable than, like, just relying on someone's sleep diary or something.
Oh, absolutely. We'll get into the whole world of real-world evidence later, but for proving whether a product actually does what it claims, RCTs are where it's at.
Okay, so then who's making sure these companies aren't just slapping clinically proven on everything and hoping nobody checks their homework?
Well, that's where the FTC and FDA come in. These regulatory bodies have the power to hold companies accountable for misleading claims.
Because I feel like I've definitely seen some products with some, shall we say, creative interpretations of clinically proven.
Oh, absolutely. There was actually this energy drink a while back that claimed it could boost your metabolism with just one sip, all based on their own clinical study.
Oh no, what happened?
The FTC investigated, found that their evidence was super flimsy, and ended up hitting them with a massive fine. So yeah, these agencies don't mess around.
Okay, that's kind of reassuring. It's like the Wild West of wellness out there sometimes, so it's good to know someone is keeping things in check.
But I do have a question. What about all those online reviews, those testimonials where people are like, this meditation app changed my life? That's got to count for something, right? Where does that fit into all this clinically tested and clinically proven stuff?
You're talking about real-world evidence, or RWE, and it's a great point to bring up.
Because it is real, right? Like people are sharing their experiences.
It is real, and it's valuable. It can tell us how people use products in their everyday lives, what they like, what they don't like. But it's not a replacement for those rigorous RCTs when it comes to proving a product's effectiveness. So even if someone swears their new fitness tracker is why they're suddenly running marathons.
It could be the tracker, it could be a new pair of shoes, it could be they finally found a workout buddy. There are so many factors at play in real life that it's hard to isolate what's really causing the change. RWE is great for noticing patterns, but it can't definitively tell us why those patterns exist.
Whereas those RCTs are designed to pinpoint that cause and effect.
You got it.
This is already making me look at product claims in a whole new light. And this is just the tip of the iceberg, right? There's so much more to unpack here.
Oh yeah, we're just getting started. We're going to dig into how these terms play out in different areas of wellness, like behavioral health, and we'll explore the fascinating world of clinical trials in more depth.
Because knowledge is power. The more we understand about the science, the marketing, and the research behind these wellness claims, the better choices we can make for our own well-being.
It's like we're finally starting to get some actual data to back up, all these wellness trends and fads.
Yeah, instead of just relying on anecdotal evidence or like, oh, my aunt's friend's neighbor tried this and she said.
Exactly. And that's really empowering for consumers.
So speaking of empowering consumers, we've covered a lot of ground here. We started talking about clinically tested versus clinically proven, and then dove into RCTs, real-world evidence, those regulatory agencies. It's a lot.
It is. And I think it's easy to feel overwhelmed when you're like standing in the store, staring at a wall of products, all claiming to be the answer to your problem.
Oh, 100%. That's like, where do you even begin? Do you just close your eyes and grab something at random?
Oh, hopefully not. That's where everything we're talking about today comes in. It's about becoming a more discerning shopper. Don't just be swayed by the marketing hype. Look for transparency.
Okay, transparency. What does that look like in action?
Does the company openly share its research? And if so, what type of studies are they basing their claims on? Are we talking about like a handful of glowing reviews, or have they actually put their product through rigorous clinical trials?
And not all clinical trials are created equal.
Right, exactly. A small pilot study with 10 people is not the same as a large-scale, randomized controlled trial with thousands of participants.
So size matters.
In this case, it really does. The larger and more diverse the study population, the more confident we can be in the results.
And what should we be looking for in terms of those different phases of clinical trials? We touched on phase 1 earlier, where it's all about safety.
Right, so if a company is claiming their product has been clinically proven to do something, you want to see evidence from those later stage trials, like phase 2 or 3, where the product has been tested on a larger group of people.
Because even if a study shows a connection between using a product and, say, sleeping better, it doesn't necessarily mean the product itself caused the improvement, right?
You're exactly right. Correlation doesn't equal causation. It could be a placebo effect, lifestyle changes, or a million other things. It's about being a critical thinker, questioning those assumptions, and looking for the full picture.
So what if a company's being vague about their research or throws around a lot of jargon without really explaining anything?
Honestly, don't be afraid to walk away. There are so many products out there. You don't have to settle for something that feels shady or doesn't sit right with you.
I love that. It's about trusting your gut and your brain. The more you understand about this stuff, the better equipped you'll be to make decisions that feel good on every level.
Absolutely. It's about advocating for yourself and demanding better from the companies we're trusting with our well-being.
Okay, so we've talked about decoding those marketing claims, the different levels of scientific evidence, and those regulatory agencies. Now I want to go even deeper into the world of clinical trials themselves. I know, it sounds kind of dry, but trust me, this is where it gets really interesting.
Oh, I completely agree. It's like peeking behind the curtain of how these products are developed, what it takes to go from an idea to something you might actually buy.
All right, so we're going full-on science nerd today and diving deeper into the world of clinical trials.
Because everyone loves a good clinical trial, right?
Okay, maybe not everyone's idea of a party, but they are important. And actually fascinating. Once you start peeling back the layers, it's like this is where those wellness claims either get real or get exposed.
I like that. It's like those cooking shows where they bring out like two identical dishes and you have to guess which one the professional chef made and which one, your buddy threw together after one too many beers.
And hopefully, in this case, we learn how to be the taste testers who can tell the difference.
Precisely.
So we already talked about phase 1 trials, which are all about safety, making sure a new product or treatment isn't going to cause any harm. What happens after that?
So phase 2 is where things start to get really interesting in terms of effectiveness. We're casting a wider net now, testing on a larger group of people, and really trying to get a handle on, okay, does this thing actually work?
Okay, so no longer just does it blow up in your face. Now it's
Yeah.
does it actually do what it says on the tin?
Exactly. Researchers are looking at things like what's the right dosage? How long does it take to see results? Are there any side effects? It's about fine-tuning that recipe to create the best possible version of the product.
Phase 2 is like beta testing a new app before you release it to the public.
I like that analogy. You're working out all the kinks, making sure it's user-friendly, and gathering feedback before you go big.
Makes sense. So what about phase 3? This is the grand finale of the clinical trial world, right?
Pretty much, this is where you're pulling out all the stops. We're talking large-scale trials, often with thousands of participants, different demographics, maybe even different countries.
Wow, so it's like taking that app global, seeing how it performs in the real world with all its messy complexities.
Exactly. And this phase can take years to complete, which is another thing to keep in mind when you see those product claims. It's like, oh, this new ingredient is clinically proven to reverse aging. Well, hold on a second. What kind of clinical trials are we talking about? A 6-month study with 20 people, or a multi-year study with thousands of participants?
Because those are two very different things.
Night and day. So yeah, knowing a little bit about the phases of clinical trials can really help you be a more discerning consumer.
It's like having X-ray vision into the world of wellness products. You can see past the marketing hype and get to the heart of the matter. Does this stuff actually work? And if so, for whom and under what conditions?
And that's the power of being an informed consumer. You're not just blindly trusting what companies are telling you, you're asking those critical questions and making choices that are aligned with your own values and health goals.
Well said. So, as we wrap up this deep dive into the world of clinically tested and clinically proven, what are some key takeaways you hope listeners will walk away with?
I think the biggest one is, don't be afraid to be a skeptic. Question those claims, look for that transparency, and remember that not all studies are created equal.
That if something sounds too good to be true, it probably is.
It's a cliche for a reason. There's no magic bullet for health and wellness, but there are ways to make informed choices based on science and evidence. And hopefully, today's conversation has given our listeners the tools to do just that.
Absolutely. It's about taking control of your own well-being and being an advocate for your own health. And remember, knowledge is power. The more we understand about this stuff, the better equipped we'll be to navigate the ever-evolving world of wellness. So keep asking those questions, keep digging deeper, and don't be afraid to challenge the status quo. We'll be back next week with another deep dive into a topic you care about. Until then, stay curious, stay informed, and take care of yourselves.